Um, it's now my pleasure to introduce our first presidential candidate. Dr. Colleen Kraft is a graduate of the first Head Start class in 1965. She went on to receive her undergraduate degree at Virginia Tech and her MD from Virginia Commonwealth University. She completed her residency in pediatrics at the Virginia Commonwealth University and is currently an associate professor of pediatrics at the University of Cincinnati School of Medicine. She's also the medical director for the Health Network by Cincinnati Children's, which is an innovation lab for alternative payment models with Medicaid managed care. This center provides data and incentives to the community-based network of pediatricians and providers in the greater Cincinnati area and helps practices understand risk stratification and proactive care management for their population of pediatric patients. Prior to her arrival in Cincinnati, Dr. Kraft was a primary care pediatrician in private practice in Richmond, Virginia, and was also the founding pediatric program director of the Virginia Tech Carilion School of Medicine. She was president of the Virginia chapter of the AAP from 2006 to 2008, and was best known for working with the legislator to improve Medicaid payment rates for pediatric services. She's the co-author of the book Managing Chronic Health Conditions in Childcare and Schools, and Dr. Kraft has been actively involved in pediatric engagement in school and childcare for children with special health care needs. She serves currently on the Task Force of Pediatric Practice Change and on the National Medical Home Initiative Project Advisory Committee at the AAP. Welcome, Dr. Kraft.
Good morning. Buenos dias. Bonjour. Ni hao. Welcome to everybody today. And I want to start off by thanking all of our pediatricians and our child health colleagues for what you do for children, because you make the difference day in and day out with what you do. You have the relationships that you've built with your families and with your patients that move them forward and build health and build resiliency. So my campaign and my platform is based on helping everybody do what you do best. It's on empowering our pediatricians on behalf of our children and our families. This is really important because of some of the bigly issues that we have in pediatrics today. So the first strategy I would look at would be, how do we connect some of the innovation that's going on with our practice? We know, for example, that pediatric urgent care might be at a retail-based clinic or might be through a teledoc who is not actually examining a patient. And we know that we don't want pediatric urgent care to become a race to the bottom. But what can we do? We can actually work with our pediatric urgent care fellows to be able to look at how we connect, how we allow our pediatric urgent care fellows to find those kids who don't have a medical home and connect them. How do we begin to start using telehealth so that we're able to use that within the practice in the medical home and do this in a way with patients that we already know, and become to the point where that otoscope app or that stethoscope app might be the top requested baby item for somebody who's having a new baby. There are ways we can do this, and I want to look at implementing these innovations. I want to look at implementing the innovation of home care and home health and home visiting co-located with a pediatric medical home, because these are all services that help our children and help our families and empower our pediatricians on behalf of children and families. I'd like to help work with the American Board of Pediatrics to remove some of the barriers that still exist with maintenance of certification, particularly for our subspecialists. Because if you're a neonatologist and you're involved in the Vermont-Oxford Collaborative, or if you're a gastroenterologist and you're involved in Improved Care Now, you are doing continuous quality improvement as part of your practice. Do you really need to do a hand washing module? So what do we need to do in order to get this to be something that is not additive but really works with our practices? And the cost needs to be lower. I've heard that for almost everybody that I've talked with. Finally, the whole issue of payment in pediatrics as payment is changing through MACRA and MIPS and some of these other acronyms that you're hearing is really important, because at the federal level and at the Centers for Medicaid level and Medicare level, we're talking about reducing cost for high care adults. Nobody right now is talking about how we invest in children and what does that cost. That's going to, right now we look at children as being healthy, but we know that if we don't invest deliberately in the developmental trajectory of children, in another 20 years we're going to be asking, why is healthcare so expensive? So I would like to be able to make that point at the macro level, at the CMS level, at the national level, because I can do that with some healthcare backing and healthcare financing information. And I would like to be your advocate, your voice, your person who is going to speak for what our pediatricians and our children need, your nasty woman, for whatever that means. So, to advocate for our children and for our pediatricians. So finally, I'll end by saying I will abide by any of the election results this year, but I'm counting on you to listen to me and to work with me and consider voting for me for AAP president. Because I am your voice, I would like to partner and empower our pediatricians on behalf of our children and our families. And thank you very much for your attention, for listening. We'll be available for questions afterwards, and best to every one of you. Thank you very much.